So this evening I'm going to talk about social workers in healthcare. They face great challenges in the new century, issues of behaviorally based coordinated care, downsizing and recognition of hospital social work staff, limited availability of services to insured and uninsured populations, increased demand for brief interventions make healthcare a formidable setting for creative social work practices. In 2008, our healthcare system was rated complex, underfunded, desperate, inconsistent, state of the art, miraculous, successful, unjust, illogical, and more. Healthcare social workers defined as one of the oldest, best established fields of professional social work practice, not to be confused with private practitioners, also known as clinical social workers. Healthcare social workers' environment. They're overcrowded with healthcare professionals, exposed to all turbulence and change of managed healthcare. Insurance company dictates the level of service. There are no longer recommendations for physicians or other professionals, treated as sacrosanct. Pressure to cut costs means that service must be provided in the briefest, most effective manner. The healthcare social work history traced back to the 19th century public health movement. All in all, not a great time or place to live. Evident that sanction programs were needed. Laws helped doctors and medical professionals gain stature. Medical social workers was first practiced in 1900 in Cleveland City Hospital, where the workers helped to discharge from overcrowded ward patients and chronic conditions and homeless Civil War veterans. Understanding the current healthcare environment. The aging population needs more services. Americans don't want to pay additional fees for medical services. The insurance industry is highly fragmented, with managers trained under different environmental conditions. There is excessive pressure to fill an oversupply of hospital and patient beds. There's a focus on treating acute illness rather than a more holistic wellness or preventive perspective that can lead to more costly treatment. Insufficient medical outcome data, impaired decision making. Too many heroic attempts are made to implement expensive procedures without regard to quality of life. Professionals try to be cautious and can order unnecessary tests and procedures to avoid malpractice suits. Direct supervision. Staff supervision is a major support activity with a long and rich history in healthcare social work. The supervisor has many roles in healthcare, but generally he or she oversees the services provided and can help to coordinate, develop, and evaluate those that he or she supervises, as well as perform administrative, educational, and supportive functions. Supportive supervision addresses such issues as stress, staff morale, and work-related anxiety and worry, which is left unattended, can lower job satisfaction and commitment to the agencies. You may find that what BSWs do in one setting is done only by MSWs in another. In today's competitive environment, work may be done in a completely different profession. The administration and related tasks have not been considered core practice areas of healthcare social work. Most prospective social workers shy away from administration, focusing instead on client-related courses. Acute and long-term care settings, social work has long been at the forefront in providing healthcare services. Hospital emergency social workers. Services are offered in many hospital emergency rooms. Home care services. Agencies have been providing high quality in-home services to Americans and have remained an integral part of the provision of healthcare services since 1905. Hospice social workers. The social work role is crucial to the family planning process, and efforts are made to help family members deal with the client's illness and impending death in the most effective way possible.